the section that we're working on right now really is dealing with two of the biggest issues that our culture is facing today, our society here is facing today, and that is mental illness or mental health disorders and poverty. Unfortunately, the two are usually very interconnected, and I want to make sure that we're really clear on what is what, and when we get to our interactive session, we'll actually be doing some exercises where we'll have discussion back and forth. Is it poverty? Is it something else? Is it neglect? Different things like that. So that's what we'll be doing in this section. Now, what I want to do here is, let's always start with a definition. So according to the National Alliance on Mental Illness, mental illness, sometimes called a mental health disorder, is a condition that impacts a person's thinking, feeling, or mood. It could also possibly impact their ability to relate to others and function on a daily basis. Each person, even with the same diagnosis, will have different experiences, and different symptoms will be predominant in the same diagnosis as well. So we need to be really careful. We're trying to be a little bit more inclusive here than exclusive when it comes to these things, because you could take two people, let's pick one bipolar disorder, and they could have widely different experiences. You could have two people who are depressed and one is functioning, and most people may not even realize that they're chronically depressed, whereas someone else, it is much more obvious based on the way the symptoms are perceived. So we want to make sure that we're aware that there's a spectrum within there of somebody doesn't always look like they're dealing with. There's no one look, there's no one thing that makes someone, oh, they have a mental health disorder. And so that is kind of what we're doing with this. So the other thing, one of the reasons why we're going to spend quite a bit of time on this and really focus on mental illness today is because it is something that is fairly common in the families and children that we serve. And so we want to be very prepared for it, if at all possible, to understanding it. So we all know I am not a medical doctor. I am not proclaiming to be a medical doctor. I am not proclaiming to be a therapist or anything on that idea. What I want to do is go through some very, very basics. Typically, some of the causes of mental illness are genetics, biology, environment, life stressors. There's a whole gamut things that may have been pre-programmed into our DNA versus life experiences that we have had. The biggest thing we want to make sure is that we're treating people as people, because someone with a mental health illness or a mental illness, it is not because they are personally weak or they have a character defect or something on that idea. It is because they are dealing with a situation. We don't blame PTSD on the victim, so to speak, that the person who's suffering from PTSD, it's not something they chose to have. It is not the fact that they aren't strong enough to walk through whatever horrific experience they've had without any scars. It is simply that they are now living in a world where they have this mental illness, this disorder that they are having to deal with on a daily basis. And so we need to also understand that mental illness really affects the entire person. And here's where I'm also going to step out of what the slides say and also offer that it affects the entire family. I don't know if you've ever, I picked depression because it is fairly well known. It doesn't have the negative connotation that so many other mental health disorders do, or mental illnesses do. And so it's more socially acceptable in so many ways. So I want to take kind of like a lot of the onus of the other situations off of it. And I want to offer that when that one person is depressed, if they've withdrawn, that affects their family, their loved ones, that affects their friends, their friendships, their work relationships. It is really important to understand that that mental illness, that mental health disorder, which is my preference for what we call these, is affecting so many more than just that one person. And I think it's really important to understand that, because when someone, I have known more than one person, in fact a few people, who were later diagnosed to be clinically depressed, and they didn't understand that they were depressed. They just thought they were going through something. And so it's really important to sometimes understand they may not even be aware, but it has affected all these people in all these situations regardless. So there is a huge impact on children. And for right this second, we're going to talk about children whose parents have that mental health disorder or that mental illness. I want to focus on them because it's easy to see some of the impact on children, and how if we can help that parent or those parents, then we can help the situation and safely potentially reintegrate that child back at home. However, I do not want to go further without acknowledging the fact that it is quite possible and probable that the child has a mental health disorder. And one of the reasons why I say that is I'm going to give you an example. I've sat in court for years now, close to a decade in these counties. And one of the things that I will tell you is I have seen cases where the child in need of care case came about because the child had a mental health disorder and was violent towards the parents or a sibling or themselves. And that's how the case started. It wasn't that the parents did anything wrong. As I talked about in that very, very first pre-work session that we had, it doesn't mean that the parents have done something wrong just because there's a child in need of care case. We need to remember that. So sometimes you have a child who no one realized had a mental health disorder, and now all of a sudden it has made a huge impact, and that's why the case began. So I don't want to just always blame the parents and like, oh, well, they have this mental health disorder and that's why this case started. Maybe, maybe not. But it's not just the parents who might have a mental health disorder. So we need to keep that in mind. Now, typically when a parent does have that mental health disorder, children of that parent typically exhibit inappropriate levels of responsibility. So what do I mean by that? I mean that you would have an 8-year-old taking care of a 2-year-old on a regular basis, making their food, making sure they're clean, bathing them, taking care of them, because perhaps the parent or parents are unable to due to their mental health disorder. They have a lot of guilt, anxiety. They may even be angry with their parents, like it's not fair that I should have to do this, and it really isn't fair to the child. But we all understand life is not always fair, and it's not fair if we really want to go down that realm that the parent has to deal with a mental health disorder either. So one of the things that we'll look at is they'll blame themselves. Well, if I hadn't done this, it wouldn't have triggered my parent. You see a lot of that in domestic violence situations as well, where they take on the world, they take on a lot of those adult responsibilities. It's very embarrassing. There's a sense of shame. They will isolate themselves many times because they don't want people coming over. I mean, think about little kids. They like to go over their friends' houses and have sleepovers and things like that. But if you have a parent who has a mental health disorder and you do not know what any day is going to look like, whether they're going to be the regular parent, the loving, interactive parent, etc., or they're going to be this withdrawn, depressed, can't move out of bed person, or they are exhibiting other more negative behaviors, you don't want to bring your friends home to that. So there's a sense for little kids that, or even older children, if I don't want to invite them to my house, they'll invite me to their house, but at some point, if I maintain this relationship, if I maintain this friendship, I'm going to have to invite them over to my house or explain why, and either one will mean I will lose this friendship. So they typically will do just kind of surface level idea of friendships, or they'll completely isolate themselves. They do have an increased risk of what we call school related problems, drug use, poor social relationships, kind of like what I just talked about, alcoholism. They also will typically are higher likely to have their own mood disorders and personality disorders based on the fact of what's going on in the home. These that they list here are really only a few of many impacts on the children in these situations, so we can't list them all. There's not that much time, but we want people to be aware of the biggest ones, the ones that you are most likely to see. So as a CASA volunteer advocate, I want to be really, really clear, and you probably hear me say this more than once, although I try not to. It is not your job to diagnose mental illness. That's not what your job is. It is your job to be observant and potentially helping with resources. So we want to focus less, I guess, on the diagnosis itself and more, okay, so in light of this framework, what resources could we recommend that the judge put in place so this family could be successful? That's more of our focus. And you know, a lot of times mental health disorders like bipolar and different things like that, they can have very successful lives and families and reintegrations. Sometimes they're just required to go on medicines or medication, or sometimes they need to alter their medication, try a different one, fix the dose, etc. And it could be something as simple as that. Now, you've heard me bring up bipolar a few times. One of the things is that is one we have some experience with. The other thing is it is really common for someone who has been suffering with or who has been diagnosed with bipolar disorder to be on their meds for a while, and then they feel great and they feel like it's over and they stop taking their meds and they feel good for a little while because the meds are still in their system until the next episode starts and they become manic or, you know, something else. And so we want people to be aware that they might have the mental health diagnosis. They might have been great while they were medicated, and then for whatever reason there are a lot of people who have mental health disorders that get on medications and it helps them, but I don't want to say it helps them too much, but in their minds they're helped, they're cured, they're done. I don't, and then their next thought is, I don't need this medication anymore, as opposed to, I don't need to worry about this diagnosis as long as I keep taking this medication. And so then they backtrack and they start to have the negative impact of the symptoms of their mental health disorder again. And so please be aware of that. It is a cycle. It is not an uncommon cycle. Now, you will have a great many people that will recognize the fact that the medications are helping them be successful in managing their symptoms and living a productive life, and they're adamant and they stay on top of their medications. That is the majority of the time, but there is a huge and significant portion who get used to things being quote unquote normal, regular, okay, and then they come off the medications and then they just spiral again. So please be aware. We do want you to be aware of what some of the symptoms are. You know, that's one of the reasons why we had to read so much before we started to dive into this, is we want to be able to look at indicators, because one of the things that we can do as a CASA volunteer advocate is recommend assessments. So one of the things that we'll find often is there's almost always a mental health assessment that is ordered by the court, except in extreme circumstances. It is almost everybody who enters the child in need of care cases, there's some sort of therapeutic assessment, and it's typically the least one is a mental health assessment. Well, that mental health assessment may lead to the diagnosis of a mental health disorder. I'm sorry, I really don't like the term mental illness. I prefer mental health disorder, but that's just a personal preference. And they will then become aware, and then there are therapeutics and therapies and different things like that. So it's really important. However, if we have a mental health disorder or diagnosis, and it is significant, it is not, it doesn't matter what the diagnosis is. Like, there's extremes. We all know that there's kind of a continuum of like, well, they have it, but they're on the low end. They have it, and oh my goodness, this is life altering. They can't really function in society. So, and it's the same diagnosis. In those more extreme ones, sometimes what you may recommend is what we call a parenting psychological evaluation. And what's the difference? A mental health assessment is checking where you are. Do you have a mental health disorder? How are you doing? Do you maybe do you have just some issues that you need to personally work through, maybe from your own childhood? Think of a parent that might have been abused or neglected as a child, and they have some leftover trauma from that, and is that what we're dealing with? They might benefit from some therapy or some family therapy or some parenting skills or whatever. That's what that mental health assessment first kind of looks at, just a broad scope. And then they kind of take it from there. Okay, do we need therapy? Do we not need therapy? There is a great many parents that take that mental health assessment and then there's no need of it any further. And so they don't have, therapy is not ordered, so they don't necessarily need that. Others, we find out that the mental health disorder is so significant that we then wonder, do they have the ability to actually be a parent at this time? And in that, if so, what needs to be put in place? Well, on many of our cases, it doesn't get to this point, but there are those cases where that mental health diagnosis really becomes significant in the case, because it is what the parent kind of needs to be able to overcome in order to be a parent. So then what we would recommend is the court order a, sorry, the words are escaping me this morning, not enough caffeine, a parenting psychological evaluation. And that looks at how functional is this person with this disorder as a parent. Do they have the ability to be a parent? And they're not talking necessarily parent of the year, but they're talking a good, solid parent. Can they provide that minimum sufficient level of care that we've talked about in the past or not? Now, they might, if they have this, and this put in place. And if that's the case, then we're good. We just make sure A, B, C, D, and E are put in place for those families. And then how can we make sure those services stay in place and things like that? So that's one direction the case could go. Unfortunately, I have seen cases where parents, married, love their child so much. Just love her. However, they were severely neglectful. One of the reasons why they were severely neglectful was because they were developmentally delayed to the point where they were basically had the mind or thought process of an 8 or 9-year-old themselves. And then we had to look at, did they have the ability to care for the child as the child grew through the different stages and different things like that. And so that was a really significant time for us to recommend, and the court did order a parenting psychological, and realized maybe, but it would take intensive services throughout the entire life of the child, which wasn't necessarily the problem. The court was ready to order that. Unfortunately, the next step is we didn't have those services in our county or any of the surrounding counties. In fact, when we looked, we didn't even have significant enough services in the state of Kansas. And so that became a whole other question of where the case went in direction. I share these things and these tidbits for you to have kind of in the back of your mind. This is the importance of that parenting psychological, and also kind of times when you would potentially want to utilize it. So those are some of the things to think about with the mental health, and that's one of the reasons why we want to make sure you understand kind of what a mental health assessment is versus a parenting psychological, because you will hear those two cases. And I will tell you that a mental health assessment can usually be done pretty quickly, because a lot of the St. Francis or contract agency workers, they have people in-house that can do that. A parenting psychological has to be done by a very specific individual. I know we only had one in our area, and he was constantly booked up, and then he finally retired, but somebody else is now doing one. But there's usually like only one, and for us in Geary County, which is a larger county in Kansas. So keep in mind resources for that sort of thing. Okay, so mental illness in families. So one of the things that we want to look at are some possible indicators that we might be dealing with that mental health illness, that we might want to be thinking about that mental health assessment or parenting psychological. If there's a lot of social withdrawal, depression, thought disorders, expression of feeling that is disproportionate to the circumstances, that is really true for a lot of people who suffer anxiety, behavioral changes, especially after a significant incident. They like something may have happened, and then after that they acted like a totally different kind of a person. So we want you to be aware, to be watchful, and you're not to diagnose, remember, but just like, hey, maybe we need to have an assessment for this or that. And when you start to think, that's where the staff is always here to back you up. If you want to kind of run it by us, we'll sit down, let's find a time together, let's sit down, let's chat about it, and let's really look at what we could potentially request or recommend that the court do to help this situation. So, mental health care for children in care. Understand that one of the benefits of being in care, although I don't like to look at it like that, when they have a child need a care case, whether they're at the home or removed from the home, is they do almost automatically get some sort of therapy unless they don't qualify. If they are well adjusted enough, then they won't necessarily need that therapy, and so it won't be ordered. But just because they don't need it at one point of the case doesn't mean you can't recommend that a new assessment be done later in the case. We have a case right now in one of our counties where the child was in therapy. They did really well. The therapist said, I don't need to see them again. Things were bumpy. Our volunteer recommended that maybe they go back to therapy, and they're like, nah, I graduated from therapy. I don't need to go back. And so then things got really significant, and the volunteer advocate had been advocating for a new mental health assessment, and once things reached a certain point, the judge completely agreed and said, no, we needed to have this. It was one of those things where the agency didn't think it was required, but the CASA volunteer did. And so at the first hearing, the judge is like, well, let's wait and see, maybe this is just a bump in the road. Let's give it, but let's also look at this case again next month, within 30 days, so that we weren't waiting, months and months. And then things had worsened, and the agency still was saying, no, we don't think it's at that point. We think this is just, normal stuff. And it turned out that this time the judge is like, no, it's gotten a little bit worse. We've tried to give it some time. I'm going to just go ahead and order the mental health assessment. And it's a good thing, because things continued to progress, and then the child had suicidal ideation. And it's really important that we're aware that sometimes our recommendations aren't going to happen, but many times most of the time they will. But sometimes they're trying to give things a chance, the child and the family a chance to settle, and things don't always settle, and sometimes we need to step in. So don't be afraid to go ahead and make those recommendations, because at least it will open up the discussion, and it will open up the judge's mind to, hey, there's something going on, we think some therapy. So there's a case where they had to do a whole nother mental health assessment in order to start this up, and we are really appreciative of the fact that that happened. So we do need to know that without adequate understanding of mental health, medications can harm children. We don't want to just say, oh, you're a super active child, I think you have ADHD, let me put you on ADHD meds, or the equivalent. That's not necessarily true. Maybe they have something else. Maybe there's something else going on in there. Maybe running is their way of dealing with trauma, or being in constant motion is their way of dealing with trauma, in which case medications could do more harm than help. Typically when there's emotional trauma involved, therapy and medication may be required. I don't want to say are required, may be required. We have seen children that have some significant emotional trauma, and therapy has been able to help them, coping skills and some other things. That they haven't required medication, or they required medication for a short period of time and then were able to come off of it later. So remember, there's no one size fits all to anything that we do here. Medications really, though, can be a part of successful intervention and treatment plan. It can sometimes help with depression or suicidal ideation, suicidal thinking, self-abusive behaviors, cutting, that sort of thing. It can also help reduce those risk-taking behaviors, where those can be so dangerous because there's so much at risk nowadays with, especially with like fentanyl, that drug, taking it once and then having lifetime consequences, or just your life ending, it's significant. And so we want to make sure we're aware. So sometimes if that is one of the issues that the child is facing, or one of the parents are facing, we want to make sure that this might be a situation where medication may help. Excuse me. All right. So typically what we do now is there is a multimodal approach to mental health. That means that there might be medication treatment, otherwise known as psychopharmacology. Typically there will be a med manager that is separate from their regular therapist. It is very rare that the same person is the therapist and the med manager. And one of the reasons why they have that now, and they do med management, they have to look at every 30 to 60 days or some, depending on each situation, is because we understand from the articles that you read and so much other information that so many people went to, we'll just medicate, and that there are definitely, there was over-medication in the past. I can't tell you if there's over-medication. I would say there's significantly less than there was when I first started, but what I would also tell you is it's a case-by-case basis. It's really hard to have one solid line, yes, this is when we do it, no, this is not, because everybody's situation is slightly different. Typically in the multimodal approach to mental health, there is also going to be some kind of behavioral therapy as well as some cognitive behavioral therapy. With little kids, you may see play therapy or child and parent. It's just like psychotherapy. That's family therapy right there. Child-parent psychotherapy is just a really fancy official name for family therapy. And typically when you have families that have had significant issues, they will start individual therapies for the parents and the children, and then at a certain point when they've kind of got everybody through that initial acute situation, they will then move to the point where they are now in a family therapy session, where the therapist can kind of direct and help redirect situations so they don't escalate. And that is kind of how family therapy typically will work. And then there's a dialectic behavioral therapy. I'm not going to get into the details of that. Please feel free to read more on that yourself. But there's lots of different kinds of therapies that, and these are just a few, but it's kind of like all the therapies work together because we want to be able to help different things. So we came up with some questions that you could potentially ask yourself more than anything, but you could ask other professionals involved. What is this medication needed for? Were you able to obtain accurate medical, behavioral, and psychological history from parents and past providers? So those are obviously questions that we would be talking to the social worker about. What evidence supports the medication? These are very in-depth questions that you could be asking potentially. Obviously, we're not going to ask the child, but the social workers, potentially even the therapists, although most of the time therapists, they're so busy around here, you won't have a chance to really interact with them like this. Here are some more questions. Will this child be able to comply with the prescribed medication? So that is one of the things that it sounds like a very funny. Will they be able to take the medication? Well, I want you to think of a situation where is if you had to have the medicine precisely every so many hours, right? And that meant that the child would be taking it, wouldn't be able to do any sports, wouldn't be able to do anything after school because they'd have to come home right away. Could that school even provide that medication? So my middle child is a school nurse currently, and she said that there's certain medications that even in that setting she cannot give. The child would have to go to a true medical facility to be able to do, even though she's an RN with all these extra things behind her name. And she said it's because she can't guarantee that the medicine would be able to, it has to be mixed right there, and she doesn't have the sterile environment, and then she doesn't have or refrigeration, or she has like a regular refrigerator, but this has to be kept at a certain temperature, and she can't guarantee that in the school system. And so those are actually some legitimately interesting things that I had never considered before having this discussion with her. And she said it's really much more involved. So, is this a shot that they have to get, but they have to, then we've got a child that's terrified of shots, and how are we going to do this? Is it possible? So I know it sounds funny, but these are some questions that you should and could ask. All right. So I want you to think about that. I've kind of let you just read the slides on these. I don't feel like the need to go through everyone. But mental health disorders, the biggest thing we want to make sure is that they're in some sort of therapy. If medications are necessary, then the appropriate medications are in there. And when I say appropriate medications, one of the things that I'm going to talk to you about really quickly is the fact that everybody's body chemistry is different. Some people take a medication. Some people take Benadryl and they go to sleep. Some people take Benadryl and it doesn't seem to affect them. Some people take Benadryl and they become wired. Why is that? That's because everybody's biochemistry works differently. And so there's no one size fits all. Wouldn't it be nice if there was? Unfortunately, there isn't. And so we need to be aware that sometimes they'll try a medicine and it makes things worse, or it doesn't go well. And this is true of parents or children or whoever may be involved in the case. It is not their fault if their medication is interacting with their system poorly, and we need to be mindful of that. One of the things that you can recommend if they're having trouble finding a medicine that works is recommend a DNA test, a DNA medication test be done. And I know this sounds really out there. However, when I first started at the program, 2015, 2016, we had a volunteer advocate who had a child that was, well, he had been in a psychiatric resident treatment facility most of his life. And due to significant and severe trauma and physical and other abuses as a very small child. And he was, probably 8 or 9 at the time. And man, they were trying everything and nothing worked. And this volunteer advocate went out there and she started looking at all these things. And so she found a very, 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 very new therapy. It had just been approved by the FDA. And that was that they did a DNA test and they compared it to the medications to see which ones would work well and which ones would not. And it was one that the judge hadn't heard of, the agencies hadn't heard of, DCF hadn't heard of it, but nobody in that courtroom was at the point where they wanted to have to condemn this child to living in a psychiatric resident treatment facility for the rest of his life. And that's what the consequences were. He was violent towards others, very homicidal and suicidal ideations of killing people or killing himself, very, very violent. And those were the options they were facing, and she just didn't want to give up. She's like, when he is good and when he has moments in the beginning where they think the medicine's going to work, he's an amazing little boy. And so she recommended this therapy. Well, they realized they were in the wrong spectrum of medication based on this test because the judge ordered it. She's like, I don't care, we're trying it. I don't want this boy to be stuck in a facility for his whole life. So they realized they were on the wrong spectrum of medications, and they used his DNA to help determine not only which medications would work best, but the appropriate dosage as well. Well, let me tell you, that was one of my favorite cases from the standpoint of that young boy was able to eventually get on the right medicine because of this volunteer advocate. Not only did he get on the right medicine, his life changed 180 degrees. He was able to get to the point where he no longer had to be in a mental health facility at all. He was able to get to the point where he was finally able to successfully reintegrate with his father. The mother had been the abuser. And he was able to go with an IEP and some specialized help. He was able to go to public school again. Now, I've checked back in with on that family, in passing. You never know who you're going to see at the grocery store. And he's doing really well. Looking to graduate soon, which kind of a little unnerving for me. However, all because that CASA volunteer advocate found this new therapy and made that recommendation. So take advantage of her amazing work, and don't be afraid in certain circumstances if medications really aren't helping, if things aren't helping, to do a DNA medication test. And they're much more common now. People know what we're talking about. We don't have to push it, all the explanation quite so much. However, also keep in mind sometimes it's not necessarily a mental health disorder. Remember what I talked about when we talked about PTSD? It might be PTSD. If nothing else is working, the diagnosis may be off because it may look like a mental health disorder, but it might be post-traumatic stress, PTSD, post-traumatic stress disorder. So keep that in mind too. All right. I always want to tell everybody that story because, again, it's the difference that you all make in what you do.